This program is brought to you by Babina Super Speciality Hospital and Presto.
Mayam Krumzari Dom Engbiribasi Impact News ni ay Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program asida taram nokchari. Ngasi akoy na akhana na puzaragli ba topic asi immunotherapy in cancer haibasini hiramasi gi matangda akupuwarol thambina ba ngasi akoy gi studio da lenction biriba expert asi miyam da shaktak jage mingwana panjarabada Dr. Brigadier Anil Kumar Dhar, Senior Consultant Medical and Hemato Oncology, American Oncology Institute at Babina Specialty Hospital, Sajiwa Jail Road, Khabeisoi, Imphal. Dr. Z, MD and Fellow Medical Oncology, Tata Memorial Hospital, Mumbai. Former Consultant and Head Medical Oncology Services, Tata Main Hospital, Jamshedpur. Former Director Medical Oncology and Bone Marrow Transplant, ARTEMIS Health Institute. Former Director Medical Oncology, FORTIS Memorial Research Institute, Gurgaon, Guinea. First of all, Doctor, very warm welcome to our studio, and thank you very much.
Thank you very much.
Thank you for taking the time to be with us here today. Doctor, as we go through your profile, you have more than 3 decades of experience in treating cancer patients and different types of tumors, and you have been honored with Vishesh Seva Medal, the Presidential Award for successfully establishing bone marrow transplant unit. So we are lucky to have you here once again at Impact News's Health Link.
Thank you very much. Thank
and to aware us about this therapy, as we know there are different types of therapy for treating cancer, like chemotherapy, radiotherapy, and now this immunotherapy. What is immunotherapy and what is the idea behind immunotherapy?
Yeah, if we talk about the cancer treatment, there are basically 3 broad cancer specialties. One is radiotherapy, second is surgical oncology, where we treat the patient by operations, and third is medical oncology. So these are the 3 broad terms, 3 broad modality of treatment. Now if you come to the medical oncology about 3 decades back when I started my career, it was limited to only few chemotherapeutic agents, and people were scared of going for treatment for medical oncology. But now over a period of time, medical oncology, a lot of expansion has taken place in the last 3 decades. And this expansion is in the form of chemotherapy, immunotherapy, targeted therapy, stem cell therapy, bone marrow transplantation, and so many other kinds of therapy. So immunotherapy is one of the modality of treatment in medical oncology, in which what we do is that we enhance the immune system of the patient so that his body is able to fight cancer in a better way. Now, by saying so, what I mean is that once we give immunotherapy, body immune system is enhanced. And why cancer occurs? Cancer occurs because the patient's immunity goes down, or any infection, if it occurs, it is because of the low immunity. By giving immunotherapy, we enhance the immune system of the body, and there are various methods of enhancement of immune system. There are we do lot of molecular markers to study which kind of immunotherapy will suit this person, because treatment of different cancer for immunotherapy is different.
So what are the different cancers that is treated by immunotherapy?
Yes, you must. To answer your question, I will say almost all cancer nowadays can be treated with immunotherapy. The only thing is that we have to identify a particular molecular marker. Now I'll explain you by giving an example. Suppose in a patient of lung cancer, there is a molecular marker called PD-L1. PD-L1 is responsible for production of a kind of a cancer. If the patient is positive for PD-L1, so we give anti-PD-L1 immunotherapy, which is either called nivolumab or it is called pembrolizumab. So these are the molecular markers. Similarly, in breast cancer, we have like targeted therapy like HER2 new receptor. Now, what does HER2 new does? It makes the worst kind of breast cancer. Earlier, we were not able to identify this HER2 new receptor, and people used to die of breast cancer, and we did not know why the patients are dying. But in 2001, 2002, or even maybe in late 90s, this receptor was identified. Once they identified the receptor, they knew why this set of patients, say about 30 to 40% of patients are dying of breast cancer, in spite of giving surgery to the patient, giving radiotherapy to the patient, and giving chemotherapy to the patient. But once we identify this HER2 new receptor, so we started treating these patients with a targeted therapy that is called trastuzumab. And with trastuzumab, the results have become better, at least in 30 to 40% patients. Now these patients are surviving more and have got good quality of life as compared to patients where HER2 new could not be detected.
Okay, so doctor, you're saying that after identifying these receptors or this marker and targeted treatment of these cells or these markers or the receptors is a form of immunotherapy.
Yes, we identify these receptors to mark up a immunotherapy drug so that it should be effective in that particular case. So I will again simplify it by giving an example. Like there is an antibiotic like erythromycin, which helps in throat infection, and there is a drug called ciprofloxacin, which helps in stomach infection. So you cannot exchange these agents. For throat infection, you have to give erythromycin. For gut infection or stomach infection, you have to give ciprofloxacin. This is just an example. Similarly, if patients who are PD-L1 positive, we have to give nivolumab. For patients who are trastuzumab or HER2 new positive, you have to give trastuzumab. So similarly, there are hundreds of agents in different cancer. Liver cancer is different, stomach cancer is different, ovary cancer is different, uterus cancer is different, lung cancer is different, breast cancer is different, so blood cancer is different. So there are various kinds of cancer which
So in that case, how much is the success rate?
Success is very good. Success, see, it improves survival by 60 to 70% for those patients where no treatment existed earlier. So it's a very good response or very good therapy for those patients.
So 60 is about 60% success rate.
Around 60 to 70% where there was no hope of survival.
So, but then can it totally cure cancer?
See, there are cancers which can be totally cured, like lymphomas, leukemias, breast cancer, lung cancer to some extent. The only thing is what I want to convey through your program is, and people who are listening, and subsequently we can disseminate this information to various groups of people, is that people should come early to us.
Okay.
But unfortunately, in my practice of last 30-35 years, I see about 70 to 80% patients, they come late, they come in stage 3, stage 4. Once somebody comes in stage 4 cancer, it is difficult to treat. Now I'll give you an example that if somebody comes in stage 1, the success rate or the cure rate is around 90-95%. But if somebody comes in stage 4, the success rate becomes 20 to 30%. So my request through your program is that if patient has got cancer, he should come early, and people should undergo investigations for detection of early cancer as per the WHO protocol. Now, what is that WHO protocol? We know it, because I cannot tell you that there's a huge number of investigations.
So when would be the right time for a common man to go for checkup to see whether he or she has cancer?
Yes, the thumb rule is 40 years of age. I will say 40 years of age for both men and women. Women for breast cancer and men for lung cancer and prostate cancer. Breast cancer is becoming is spreading very fast. It is increasing. It is becoming in common people, particularly in urban population. It is becoming very common. And similarly, cancer of the cervix is becoming very common in the rural population. The reason is that in urban population, the lifestyle, which is responsible for breast cancer, and in cancer cervix, it is the hygienic part.
Okay.
The viral infections, they are responsible for cancer cervix. If you allow me to say that in ladies who do not maintain proper hygiene, who do not take care of their infections of their private parts, or those people who have got multiple sexual partners, they have got increased chance of cancer cervix.
Okay.
But we have got remedy for all these things. Breast cancer, we start surveillance, we start investigation at the age of 40 years. And we advised mammography, at least mammography. Once you come to our hospital, we advise. But if there is a history of breast cancer in the family, we should go for mammography early or ultrasound of the breast early, maybe at the age of 30 years.
So thumb rule is 40 years of age?
40 years.
Okay, and then what is the next thumb rule?
Next thumb rule is the hygienic part in the ladies.
Yes.
You should. And cancer cervix, the surveillance starts at the age of 21. And you have to do a pap smear minimum every 3 years.
What about bone cancer and other blood cancer? Are these hereditary? Or this
Some of the bone cancers are, I will not call hereditary, but I will call they are basically carried by some genetic abnormality, like chromosomal translocation. I'll give you an example that there is a blood cancer called chronic myeloid leukemia, where there is chromosome number 9 and chromosome number 22. There is abnormality between these two. And once they become abnormal, they produce abnormal proteins in the body and they cause blood cancer. So similarly, if you ask me what are the genetically determined cancer, I will just tell you one is the breast cancer, very important. If you are in your family, your family member or the blood relation has got breast cancer, like your mother, your grandmother, then go for early checkups. Similarly, colon cancer, they got genetic abnormalities. So these 2-3 cancers are genetically.
How about
determined.
throat or oral cancer?
Throat are basically, we buy cancer.
Okay, it's
We
because
buy
of
throat
things
cancer.
that we consume.
Yeah, because we consume lot of things. We consume alcohol, we consume
Tobacco products.
we consume supari, we consume pan, we consume spices, we consume we have bad oral hygiene. So these are we buy it. They are not genetically. God never gives this cancer to us, but we buy it. But breast cancer, yes, genetics plays a lot of role in breast cancer.
Thank you, doctor. Now, we would like to know more about the candidate who is right candidate for immunotherapy, but after the break. Matang aswada atin ba commercial break talog break matung da immunotherapy in cancer hariba topic asiki matang da amukha na khamina kishi.
reached the pinnacles of success. Get enrolled to one of the finest schools in Northeast India, UNESCO School, Excellence in Education.
Presto Personalized Wonders, Imphal da nauna hangdok chare, hairiba asida personalized gifts, corporate gifts, awards and mementos, home decor, office rubber stamp na chingba potlamsing mafam asida phangbigani ngasi maglangsing birau Tilak Ras Enterprises, Presto, Thangal Bazar near Kasturi Thong, Imphal. Contact number 0385-244-9025 natraga 98621-00456.
Break matungda amka hana taram nokchari. Doctor, before the break, we were talking about immunotherapy and how various type of cancers happen to us. Some are genetic or chromosomal, and some are environmental or external factors like consumption of alcohol and tobacco products. Now, doctor, as we are talking about immunotherapy, I would like to know what kind of patients are eligible candidate to take this therapy, and what kind of patient are not good candidate for this therapy?
Yeah. So I'll answer your second question first. Those candidates who can be cured by operations should not get immunotherapy.
Okay.
Why? Because once patient has been operated, tumor has been removed, patient is cured, immunotherapy is not required. Immunotherapy is basically required for those people who have got bad cancer. Bad cancer means we've got advanced stage of the disease which cannot be operated.
Okay.
Like stage 3, stage 4 disease. Particularly it is meant for stage 4 disease. So what we do is that those patients of stage 4, advanced stage disease, I'll call advanced stage cancer, who have not responded to the conventional first line treatment. There is a first line treatment, like it's in army, there is first line defense, second line defense, third line. Similarly, in cancer treatment also, there is first line treatment, second line treatment, and the patient has not responded. Then what we do is we take out the biopsy of that particular individual, biopsy which we had done earlier. There is a block of biopsy, there is a VEX block. You must have seen the glass slides and
Yes.
the VEX block. Now this VEX block we send for molecular marker study. There are various centers who are doing this molecular markers studies, and we also are performing molecular marker study. And once we identify a particular molecular marker, like I'll give you example, like I told you PDL1, there is TMBH, there is BRAF V600, these are the markers. Once we identify that this tumor has got this marker, then we start that particular immunotherapeutic agent for that individual, and it helps. It helps. Basically, particularly in lung cancer, I have seen response is good. In breast cancer, response is good. In uterine cancer, response is good. In ovarian cancer, response is good. And cervical cancer, response is good. So those, I will sum up by saying that those people who about 5-10 years back, we used to leave them saying, "Aap kuch nahi ho sakta." These people are being treated with immunotherapy with about 60 to 70% response.
So immunotherapy is the last resort for these patients who are not responding to conventional or any other methods.
Yes, but
of
they
therapy.
are positive, molecular markers are positive for that particular agent.
Okay.
If they are negative, then we cannot give them, because then it will produce harm to the patient.
So identifying the marker is very important.
Yes, identification of correct marker for correct agent.
So why is it that it's difficult to identify the correct marker for some patients, and for some
See,
it is identifiable?
It is, you can call it, it is basically in the genes. because these are the markers which has given or stimulated the cancer in the body. But those 30-40% patients where markers are negative, we cannot give this immunotherapy to the patient. Only those patients who have got molecular markers positive, we should give immunotherapy to that particular patient.
Then how is immunotherapy given to the patient? Is it through injection or medicine, or?
It is simple injection. It is through intravenous, given in glucose, saline, and maybe in 1 or 2 hours it finishes. But the person who is giving immunotherapy should have experience of giving this immunotherapy,
And
because it's got a lot of side effects.
like
It can cause lungs problem, fibrosis it can cause pneumonias, it can cause liver damage. So you should have an experience, number one. You should know what you are giving it. You should know the side effects so that you take the precautionary measure, because to prevent the side effects we have got antidotes. We give them simultaneously or after the immunotherapy is over. And once immunotherapy is over, we should be able to identify the side effects of this immunotherapy and treat it correctly.
so apart from liver fibrosis, what are other side effects like hair
blood
loss?
blood counts may go down. You may develop infections. You may develop jaundice. You may develop cough. You may develop fever. You may develop pneumonia. All these features.
What about physical effect like hair loss?
Immunotherapy does not cause hair loss.
Chemotherapy cause?
Chemotherapy causes loss, because chemotherapy works at the cell cycle,
Okay.
right? But immunotherapy does not work at the level of cell cycle. It works at the immune level. There are T and B cells. So the function of or mechanism of action of immunotherapy and chemotherapy is entirely different.
So how long a patient has to take this immunotherapy to come to that 60 to 70% success rate?
Yeah, normally recommendations are that we should continue therapy till disease progression, but usually we give 4 to 6 cycles, see the response and see whether the patient is responding or not. We do a PET scan to see how much the response is there. So we must know that we have given immunotherapy. Whether the patient is responding or not, we should know it. And if the patient is not responding, we should stop it.
Do patients need to hospitalize while taking immunotherapy?
It's a daycare. Patient comes in the morning and after taking therapy, he goes home.
Any diet restriction?
Dietary restriction is there, like patient should maintain the hygiene. Patient should not take any raw thing. And homemade food, outside food is not allowed. So these are the major dietary restrictions the patient should have. Basically, the patient should remain in hygienic atmosphere. That's
So not much of outdoor activities?
He can go outdoor, but at a place which is hygienic. He should go into the open park, he can go, but not a place where the industries are there, a lot of smoke is there, and unhygienic areas are there. He should go in a hygienic, open area where the air is fresh.
Doctor, as we know that cancer treatment is not very cheap, it usually comes expensive, and since immunotherapy is the last resort, as you have mentioned, so is immunotherapy the costliest of all the therapies for cancer treatment?
Actually, I should say immunotherapy is not the costliest, but it is costly. It is costly costlier as compared to the chemotherapy. But you will be happy to know our Chief Minister of Manipur state has given a lot of support to the cancer patients. They get a lot of funds.
Health
That
schemes.
support is there.
Yes.
That support is there. I am treating a lot of patients through Chief Minister's scheme.
Okay.
So that's a very good thing. Even the Modi government has given a lot of support to the cancer patients. So I feel it's a very good thing which was not existing earlier. So I must appreciate the effort of the government.
Thank you, doctor. So this means immunotherapy, apart from other cancer treatment facility, even immunotherapy facility is there in Babina?
Yes.
AOI
Yes,
Babina.
yes,
Okay.
yes.
So at least there is some hope that even after failing to respond to all this chemotherapy and radiology, radiotherapy, sorry, there is still one hope of immunotherapy
Yes.
to get 60 to 70%
Yes.
cure.
Yeah. Yes.
So, thank you so much, doctor. Would you like to give any message to our viewers?
My message to the viewer is that they come early to us for the treatment if they got cancer. Get their investigations done at as per the recommendations, and they should be aware that government is now opening lot of schemes for the cancer patients, and those people who are not aware of this fact should try to avail these facilities, because it's a lot of help, financial help, plus it's a moral support also to the patients. Yes, there is somebody who is helping us. And lastly, I will say that we got a wonderful facilities at American Oncology Institute, Babina Cancer Hospital, and we have got a trained staff. That's very important. So we will be able to do justice to the patient. So that's my message.
Thank you very much, doctor. Thank you once again for taking the time to be with us here today.
Thank you very much. Thank you.
Nasigidi impact news ki impact headling matanga shwari loislakle akoina cancer line nabagi damakta therapy makhal mayam leri chemotherapy radiotherapy adegi oncology gi surgery si mayam zida respond tawdraba patient singna immunotherapy hariba treatment makhal asida kano lying bayagani cancer do 60 to 70% fa bangamgani haina doctor thambiri loina na American Oncology Institute at Babina Specialty Hospital, Khabeisoi, Sajiwa, Jail, Delariba Hospital, Manipur, Amatangarba Cancer Hospital, Asida, Hoigi, Chief Minister Haksengi, Tembang Scheme, CMHT, Amadi Ayushman Bharki Makada, Scheme Mayam Health Scheme, Mayam Laribasi, Empanel Toraba, Dukumla Hospital, Ni Aduna Madugi Kudong Chabuzula Wiu, Aduga. Cancer gi treatment cancer na patients sing asi atopa treatment method respond tawdre fagat pangam na roi haina wakhan hanna dana like the vida hariba immunotherapy asigumba treatment makhal asi si khudong chaba si lobiu hairaga ngasi gi impact news ki healing gi program asi matanga shwai loisinjaragi. Thank you.
Manipur gi apun bagi saktam da singnarak pada ngakthong naba hona pada United Committee Manipur na sokthabal leite United Committee Manipur gi mayai loisan gi sanglen ase matamga sanana chengbat thagat pagi matam yaure United Committee Manipur na sagatur ba sanglen ase Manipur gi apun bagi saktam kai wi yaroi haina laurum